Here with us now to take a deeper dive into the latest Ebola infection is Dr. Devi She's been with us before. So were you expecting this to happen in New York eventually?
I thought we might have a case show up in New York just because of the nature of the flights. New York is such a cosmopolitan city, but I didn't expect necessarily this whole issue that we've had now.
The fact that he was on the subway, that he went to a bowling alley, is that of any concern?
Well, so there's two things to consider. I mean, in his particular case, he didn't have any symptoms at the time that he went to those places. So no, I don't think New Yorkers need to be concerned. I mean, he wasn't infectious at that time. But it does kind of raise the concern, well, what if somebody else who was sick, who was actually having symptoms, just was able to get on the subway? You know, what do we have in place to protect people?
The New York and New Jersey officials have said that at the airports now, at JFK and Newark, that transportation officials will have the ability to order somebody into a 21-day quarantine. Is that a wise idea? Should we be trusting airport officials to tell somebody, you must go home for 3 weeks?
I think it has to be very clear why they're putting someone in quarantine. Otherwise, you know, people can say that it's discriminatory. Why is this person in quarantine and not the other person? I mean, I think it's good that we are doing these measures, that we are trying to do something. But the fact is, you know, what would we do if it's an American citizen, which is what happened in this case? You know, will there be an issue with that? I think one of the things we could do to make it easier is to also have a quarantine team. So if someone is in quarantine, you know, why do people want to get out of quarantine? You know, either they have to go to work, so they have to make money, you know, or they have some other obligation. They have to take care of their kids. They have to take care of something else.
Or they really like takeout.
That's true. And delivery, I mean, you don't want to be the delivery guy who's going to see the Ebola patient, right? So the thing is, I think we can make it a little bit easier for people by creating some kind of strike team that manages the folks in quarantine so that they can actually comply with it.
Any worries about the people that Dr. Spencer may have been in contact with, his girlfriend, people he went bowling with, people he might have shaken hands with?
Well, the girlfriend is different because he might have had more, you know, close contact with her. So they are monitoring her. In terms of the people that he went bowling with, I mean, the people that were with him, his close friends that might have spent more time, that might be a little bit different because they might have seen him once he started developing symptoms. But for the people who just happened to be in the bowling alley or on the subway, I don't think they have to worry at all. They wouldn't have been exposed to his bodily fluids, especially not when he was infectious because he wasn't having symptoms yet. But I do think there is a concern about the mixed messages because if it didn't matter, why are we looking at these things? Why are we finding out about the bowling alley and, you know, tracing his steps using his Metro card? So it kind of creates some confusion to look at those things. I think it makes sense to look at it so we have a plan for the future, but not necessarily to alarm the people who might have gone bowling that night or gone on the subway.
There are a lot of good Samaritans like Dr. Spencer who have been in West Africa trying to help. Should there be some sort of uniform standard or some sort of clearer protocol that the officials give us all about what to do?
I think they should, because obviously if he's risking his life to go there, which is what he did, right? He is a hero, so he doesn't want to jeopardize the public. That's not his intention, but definitely there has been alarm as a result of this, right? So I think that if we did give people clearer protocols, if they knew exactly what they had to do or not do, it would be a little bit easier for them to follow. I mean, the thing you worry about is if you have a 21-day quarantine, are people really going to be as willing to go out there? Because presumably they have to get back to their jobs and get back to other things when they are back here.
And again, just to remind everybody, suppose, let's take a worst case scenario. Suppose somebody comes back from West Africa, they have Ebola, they're showing signs, they're coughing, they've got flu-like symptoms, and they take the subway and they put their hand on the pole to hold on.
Yeah, so that's...
Can you get it by putting your hand there?
Well, I mean, we can't say for sure. We can only look at the experience, right? So Thomas Eric Duncan, you know, he traveled here on a plane also. And none of the passengers, they traced those people and none of them developed Ebola. Then he started having symptoms. I mean, he went to the ER to get checked out and he was sent away. So presumably he also came into contact with people in the ER, including the staff and other patients and other people along the way, but none of them developed Ebola either. So it looks like, you know, even though the virus may still be present in bodily fluids, you're more at risk if you're really coming into contact with a lot of bodily fluid once the person is really sick, which would be, in his case, the ICU setting.
Dr. Devi, always a pleasure having you on. Thanks for coming on tonight.
Thanks.
We appreciate it.
Thank you.